Good morning, Professor. Good morning, class. Today, my presentation is about COVID 19 and the importance of diagnostic testing. First, let me give a brief introduction about COVID infection. Coronavirus or COVID 19 is an infectious disease caused by coronavirus, and it was first identified on December 2019 in the city of Wuhan, in the region of Hubei, China. This disease has resulted in ongoing pandemic, and the common symptoms include fever, fatigue, shortness of breath, and difficulty of breathing. It also causes loss of smell and taste, and this disease spreads most often when people are physically in contact. Uh, the recommended measures to prevent the infection is frequent hand washing, social distancing and quarantine, covering coughs and sneezes, and keeping unwashed hands away from the face. Regarding the diagnostic testing, author Sarah Tiner on June 16, 2020, on the topic of the importance of antibody testing, states that for COVID-19, a specific protein from coronavirus 2 is used as a target antigen in the ELISA to detect any antibodies in patient serum that can recognize specific viral protein. She recognizes the importance of serology and how much it contributes for COVID pandemic. Um, one new test which is widely used approach for this detecting antigen is called ELISA. ELISA appears to be cap- capable of detecting COVID-19 antibodies. And ELISA is an acronym that stands for Enzyme-Linked Immunoservant Assay. The Mayo Clinic evaluated multiple different commercially available serologic tests, and this Mayo Clinic recently selected ELISA as the excellent clinical sensitivity and specificity. And this ELISA is used for clinical trials for convalescent plasma donors and patient testing. Uh, the whole concept of increased COVID testing is mandatory because it helps for treating patients, isolating contact cases, and for reopening the economy. The author Ken Altek and Roman Padilla on September 23, 2020 says that the United States needs 30 million tests in a week to adequately track the virus and protect vulnerable infection. By now, the nation reached only 1 million daily tests for the first time in this week. And this is because it helps to control the pandemic by treating the infected people and tracing the exposed people and to quarantine them. In addition, the website COVID-19 Science on the topic of why testing is so important states that the diagnosis is the diagnostic tests are very important to quick identify the cases, to quick treatment for those people, and to immediately isolate the prevention of the spread. Early testing also helps to identify anyone who came in contact with infected people to treat quickly. In other words, these widely distributed, rapidly diagnosed tests helps to diagnose and to help control the spread by early detecting those who have contacts. Regarding tracing and isolating suspected cases, author Johnny Wood in the meeting of World Economic Forum writes that the Director General of World Health Organization, Dr. Tedros Adhanom, says that for every suspected case, if they test positive, isolate them and find out contact cases within 2 days before they develop symptoms. And according to CDC, Center for Disease Control and Prevention, those recommended to be tested by the CDC are first, people who have symptoms of COVID-19. Second, people who had close contact within 6 feet of infected person for at least 15 minutes. And the third group of people who need testing recommendation are those who have referred by healthcare workers. CDC emphasizes the group of people who need priority to be tested. This is because not everyone can be tested by the moment because shortage of manpower and test kits. And now let's move to the second use of COVID testing, that's for reopening the economy. As we know, this disease has economic and social crisis. Author Mindluber on March 26, 2020, in the Forbes magazine, writes that as the world struggle to contain the rapidly pandemic, hundreds of thousands of people are fighting for their lives, and global economy and the global economy is in danger. This means this pandemic is painfully remember of the social well-being, and it carries enormous risks and sudden shocks on our capital, on our economic capital, on our social capital. So we need for mass mobilization to tackle this crisis. Many people become jobless, many become sick with coronavirus infection. So the big question is how to reopen the economy during COVID pandemic. Author Pentland on April 30, 2020, on the topic of how to reopen the US economy and keep workers safe, states that the economic devastation caused by COVID-19 pandemic has been swift. US retail sales have been collapsed and industrial production has fallen too much. So there is a widespread agreement among the experts that restarting the economy requires more testing of the virus. And so we need to adjust the problems of the economy by standard precautions. And to reopen the economy, our health system should treat all COVID patients without crisis and to test COVID suspected cases with full potential. And Dr. Patrice Harris, she is Emory, in April 17, 2020, in the meeting of American Medical Association, said that we must expand COVID-19 tests before restarting the economy. Of course, decreasing COVID positive cases and symptomatic cases should be seriously considered before reopening the economy. So only these data information necessary for public health officials, they can determine how we reopen the economy and how we resume a semi-normal way of life. In conclusion, coronavirus disease is an infectious disease caused by coronavirus infection, and prevention is avoiding close contact and hand washing, and COVID-19 testing is important to control the pandemic and to treat the patients and to trace exposed people. And it is critically important that for public health officials to reassess and to reopen the economy. So until scientists, researchers, and investigators find effective treatment for COVID-19 and the vaccine, we should emphasize on the prevention methods. So stay safe, stay well, my class. Thank you for giving your ears. Do you have any question or any comment? Okay, thank you guys. Thank you so much. I appreciate your patience and giving your ears to my speech. Thank you. Have a good day.